for example, they have ADHD, you get them started on medications, those can jump into being within the normal because they have problems with their digit span because of their ADHD. Okay, so those are interesting to see. Okay. So assessing psychological disorders. So what is the purpose of the clinical assessment? Okay, guys. All right. Yes, thank you. So we want to understand the individual, you want to predict behavior, you want to plan treatment, and you want to evaluate treatment outcome. So generally you start with a very wide base and you work your way upwards, all right? Behavior assessments focus on the here and now, okay? So these are behavior checklists, and a very famous behavioral assessment, okay, is called the Autism Diagnostic Observation Schedule, all right? It's called the ADOS. This takes probably around 4 to 6 hours to do, all right? So you have an autistic child, and it's divided into age groups like younger, sort of school age, teenagers and adults. There's like a booklet for each, and you have the patient in the room, and there's specific things that you actually give them to do, and you just observe their behavior, and you mark it, and then you give them a score, okay? So these are usually good for when you are sort of a gray area, you're not sure what the diagnosis is entirely, so you get into these sort of behavioral assessments. Okay. So the psychological testing can be objective and it can be projective, okay? The traits. So what are your traits? What does that mean? Your traits. Okay. So this is a guy who interviewed Freud. Like he went to see Freud because he wanted to learn about personality and traits, okay? So he figured out from the very start that Freud was so into the deep and unconscious and all of that. But so this was not what he was interested in. He wanted to sort of look at fundamental traits, okay? So people's characteristics, and he was less concerned with explaining them and just wanted to describe them. Can you imagine how many traits there are to describe people? How many words, how many adjectives are there to describe a person? 2,000? 2012. It's about 18,000. 2012. So there's about 18,000 traits out there that can be used to describe a person, okay? So what they wanted to do then is to kind of put some kind of a mechanism, because you're not going to go through a checklist of 18,000 words, okay? So these guys, British, I think husband and wife, Eismick and Eismick, they believe that you can reduce this to sort of 2 areas, which is extroversion, introversion, and then emotional stability and general and sort of instability, okay? And they put people on a sort of a scale, if you will. So going from unstable to stable, from introverted to extroverted, okay? And then you go from moody to quiet. They're supposed to be following each other, so to be moody, anxious, rigid. So going from more unstable to stable, okay? So when you have someone tested, they can come out based on the questions that they are asked into one of these quadrants, okay? Or a mixture of. Did they ever test you guys before you get into medical school? Like, do they do a personality assessment or anything like that? They see your grades and scores. But in the interview, right, when you're in, that's it. They don't have. But after you guys, they said they have to develop because I mean, part of when you go for any residency program anywhere, the interview is not based on how much you know, okay? I remember when I went for my interview for psychiatry in Vancouver, I was like, oh my God, I don't know much psychiatry. So I started studying before the interview, and I went in and they didn't really care what I know because I'm going to learn. They were more interested in my character, my personality. Am I somebody who's flexible? Can I adjust? So it was sort of a mini personality sort of. So that's what you're going to go through if you go for a residency. They really want to know. I just felt like awkward because they're not asking me what I thought they would be, so it was just a general sort of discussion.
What are they looking for? So we can prove that the things that we are
Well, you see what happens is your actual person comes out. They ask you things that, and the way you respond to it, because you're caught off guard, okay? So it's not anything you can prepare for. So you're completely caught off guard, so your actual personality shows. So they can either refuse you or accept you. All right? A very sort of important test for assessment of personality, okay guys? Those of you who do watch Criminal Mind, so the Minnesota Multiphasic Personality Inventory, okay? So this is about 549 questions that you answer true or false to, okay? So these are some examples, okay? Something like, no one seems to understand me, true or false, okay? I get all the sympathy I should, true or false? Okay. I like poetry, true or false? True. Nothing in the newspaper interests me except comics. So it's 579 similar type questions, okay? So let's say you're going to for a job interview and they do this MMPI for you. So a question like, guys, a question like, I get angry sometimes. Okay, true, because that's honest. But somebody who wants to get the job is probably going to say false. I don't get angry because they want to.
Liars.
Exactly. Because there's something called a lie scale. So within the 579 questions, there are some trick questions that will pick up the sort of, if you score on them so oddly off, the lie scale is high, and so you're a liar. You're not going to get the job, okay? So that's why it's a very interesting and it's a very popular assessment, okay? It's very objective, and it's sort of it's been translated into over 100 languages, so it's applied worldwide. Okay. Then we have the big 5 factors, all right? So they realized these Eisenach's dimensions are kind of limited, so they expanded it to a set of 5 factors, and this is the winning test in the personality lottery, is what they say, okay? So it's the best approximation of basic trait dimensions. So we use the MMPI and we use the big 5. So what are the big 5? Okay. So they are conscientiousness, okay, agreeableness. It goes into an acronym of CANOE. So CA, and we'll complete the others. So you can see here, you can go from organized to being disorganized, from careful to careless. So you have 2 ends of a spectrum, all right? Neuroticism, okay, openness, and extroversion, okay? So based on questions that you're asked, then you're gonna score high, for example, in extroversion. So that means you're a sociable person. If you score high on being very neurotic, so maybe you're not very flexible, or you're kind of rigid. So it gives you an idea of the type of person that you are, okay? So these traits are very stable, okay? So maybe in your middle adulthood, you could be a little bit emotionally unstable, maybe, and that settles down. For example, then, agreeableness and conscientiousness, they definitely increase with age. So the wiser, the older the wiser, because then you become more agreeable to things, you're more flexible, okay? So your personality traits can sort of change over time depending on your experiences, okay? So are these heritable? You think? Yeah. And you find that common when a lot of them are heritable. Like you'll find somebody in the family with very similar traits, and that's a very common question we ask, does this child remind you of someone else in the family? Do you remind your parents of someone else in your family? Because you'll find some of them are there, okay? Do they predict other personal attributes? So they say yes, if you're somebody who's very conscientious, you're somebody who's going to be very likely to learn better, earn better, and do better in life. Okay? So it predicts better outcome. We're almost done, okay? You're going to ask a question?
So then they usually compare you to like an uncle or a cousin, but based on like race. And then they compare you like sometimes they want to compare you to them. So they'll make up things that probably is not very similar. So we never had these tests like that.
No, but you see, in doing that, they are already they formed a standardization. So to them, that uncle is sort of the ideal, so that's the standard. And they compare everyone to that person, so that makes it more of a reliable and valid comparison. So it's very, it's not scientific, but it kind of follows in the same trend. But I mean, these tests have been around for years. Okay. Well, you know, that's what I'm saying. Maybe we should all get tested before we get into medical school, or.
But the personality, I think it's environmental. Because if you take two.
Can you guys hear what he's saying?
Yes.
Do you know who's talking?
Okay.
If you take two twins that were separated at birth and put them into different families, they're gonna have different personalities. If you put one into
Not always.
if you put one in a conservative family and another one in a liberal family, one of them is gonna have an uptight, and the other one is gonna be more.
I mean, the whole thing about nature and nurture, environment and genetics, it sure affects you. I mean, you'll find if you're raised here and your cousin or brother is raised in the States or whatever. But I mean, your example of twins, because these are genetically identical, and even there you can. But you'll find that some of the basic traits will be the same, but maybe the way that they are expressed is different. But take that person and put them in the same type of environment, they're probably going to change also. You know what I mean? So you can have things modified, but your basic traits are going to be the same. Okay, guys, have you ever heard of the ink blot test?
Yes.
What is that?
They have this ink blot that looks like certain ones that you and you ask them basically what they see. I personally see an elephant, but that's it. There's different ones. I think there's like 12 different.
Okay. So a very sort of simple example. You know that very famous picture? Is it an old lady? Is it a young woman? Okay. So that's kind of, you know, what where projective tests. Okay. So the sort of the background is that you use unstructured guys. So you're going to use relatively unstructured and very ambiguous test stimuli. Okay. So it's, like you said, it's just ambiguous. It can mean different things to different people, all right? And the basic assumption is that when you are confronted with a vague stimulus, all right, people cannot help but reveal information about themselves. So as much as you try not to, but actually your real self comes through, all right? So the famous one is the Rorschach, okay? So there's 10 plates, right, with ink blots on them. And these are presented to the patient one at a time. Okay, so again, so he's shown one, and then he's going to say elephant, bird, whatever, and you have to record it verbatim. And then you go to the scoring system where, like, there's a standardization for that particular ink blot, where most people are going to say this, and fewer people are going to say that. Okay. And it's usually very good to assess psychosis. So when you send somebody with schizophrenia or somebody who's psychotically depressed and get this assessment done, you know, you're gonna see all the sort of craziness in what they report that they see. Okay, so it's good for anxiety, depression, suicidality, psychosis. Another one, which is not really used much these days, it's called the thematic apperception test. And basically it's 20 cards with pictures on them. And these pictures vary in content, and most contain either one or more characters, and there are various degrees of ambiguity. So some are clear, some are less clear, okay? The patient is asked to construct a story with a beginning, middle, and end based on the stimulus card. So you give them a card, okay? And then you tell them, okay, I want you to give me a beginning, middle, and end to this story. Okay, so anything can come out, right? Here the scoring is not very standardized, that's why it's kind of lost its potential over time, but there are some psychologists who still find a lot of benefit in doing it, okay? It provides information about current themes like your mood state, if you're having any conflict, interpersonal relationship problems. These can come out in a story that you tell, okay? And there's also one for children that you can use. I think we just have 2 more slides left, right? So, and I'm not going to go over details of this, but this is another application of psychological testing, which is neuropsychological, and it's used mainly for people where you think there's an organic brain problem, right? So, often where I work, so kids or adults, pre-brain surgery and post-brain surgery, they have to have a battery of neuropsychological tests. Can you figure out why? Yeah, because you want to know if you're going to damage something or not, okay? Also, post-head injury, You need to do it like 6 months after because you want to see what their baseline is going to be.